Now, a junior doctor who spent almost 12 years fighting a whistleblowing case is back in court. Dr. Chris Day, who says he originally lost his job after raising serious concerns about patient safety at the hospital where he worked, is now taking NHS lawyers to court. He claims legal attempts to deny whistleblowing protection for all doctors in England below consultant level would never have gone ahead if the law firm had disclosed documents which contradicted their case. Dr. Day has been speaking to our health and social care editor, Victoria MacDonald.
Dr. Chris Day is, and this is somewhat of an understatement, incredibly tenacious.
I have been, which isn't always the case with whistleblowing cases, I have been lucky to have supporters walking with me through this. It started with 5,000 crowdfunders, and I think that has given me a lot of energy and a lot of confidence.
He was a junior doctor when he warned his bosses at Lewisham and Greenwich NHS Trust in South East London that the intensive care unit at the Queen Elizabeth was worryingly understaffed at night.
Shortly after that, within months of me raising it, 2 avoidable deaths happened that raised exactly the same issues in my disclosures.
In 2016, the Trust said they had investigated his concerns and increased staffing numbers in the ICU. What they didn't say was the impact on Dr. Day's career. It was devastating. His training number, which all junior doctors need, was withdrawn, making it impossible for him to become a consultant.
I've had my career destroyed from an NHS cover-up and smears. People have seen what has happened, and it has sent a very, very chilling message.
For 4 years, the NHS and Health Education England argued they were not the employers of junior doctors in England, that they were responsible for training only, and therefore he, and as it happened all junior doctors, could not claim to be whistleblowers. In his past legal battles, it has been revealed 90,000 emails were deleted by a staff member at the Trust in the middle of a court hearing. The email account of the Trust's Director of HR was also deleted, and it was denied a board meeting was held to discuss Dr. Day, the minutes later discovered.
Apparently the rules don't apply, even when when a whistleblower is in court and the opponents destroy evidence during the hearing.
But he won the whistleblowing argument, and in 2018 finally came before the tribunal. Yet after 6 days being cross-examined, he withdrew his claim. He later said it was because he was threatened with huge costs if he continued. This was denied by the Trust and lawyers, but Parliament heard otherwise.
He and his wife couldn't face the prospect of losing their home for their young family, and so he caved in. It is surely a scandalous treatment of a junior doctor. Our public NHS should not be threatening doctors or anyone else working in the health service with costs in that way to prevent an issue of serious concern about safety being heard in court.
The Trust said it has always taken seriously the concerns raised by Dr. Day in 2013, and it added an employment tribunal found that the Trust had not subjected him to a detriment due to him raising concerns. This decision was upheld on appeal. Now, 12 years later, Dr. Day will once again return to court, this time taking a case against the NHS lawyers. He claims the law firm Hill Dickinson knew all along that junior doctors did have whistleblowing protection because they themselves had drafted the documents.
On the 11th of March, we're basically saying, how can you possibly justify the taxpayer paying you to make these arguments to effectively undermine whistleblowing protection for the nation's doctors? And we're hoping that the judge will be receptive to that fairly basic point.
Hill Dickinson told us they can't comment on live or client-related matters. It's estimated more than £1 million has been spent fighting Dr. Day, and it all began here with an understaffed intensive care unit. And even today, he says, he makes no apologies for not giving up the battle.